I'm going to talk about cutting edge MLS laser at Central Florida Foot and Ankle. We've had it for almost 3 years now, and I can tell you that I've been pleasantly surprised how effective it is in treating a lot of inflammatory diseases such as Achilles tendonitis, plantar fasciitis, diabetic neuropathy, and also help with postoperative healing. Um, when I first purchased the laser, I was a little bit skeptical, and it took me a couple of months to start believing in the technology, but it definitely works. It actually works on the mitochondrial level, where the cells that are damaged or they're affected by the inflammatory disease like an Achilles tendonitis or plantar fasciitis. What happens is that the laser works on two different wavelengths, and it affects the mitochondrial reaction where the cells are able to regenerate. I have used it on conditions such as painful diabetic neuropathy, a lot of plantar fasciitis, some neuromas, a lot of Achilles tendonitis, because unfortunately with Achilles tendonitis there are a lot of patients who do not want to have surgery because it requires about 4 weeks of non-weight bearing, which is pretty tough. We have used it also in postoperative recuperation, and we've even had patients who had both feet done at separate 2 different times, and we have seen a significant improvement in rehabilitation time when we utilize the laser after the surgery. I think it's a new technology that is definitely going to improve patients' well-being, their lifestyle, and reduce their pain, and definitely should be utilized as a first course of treatment before surgery is indicated. I know it's very unusual for me to make a statement like this, but even with 5,000 surgeries behind my belt, I always recommend that patients try non-surgical treatment first and see if it works. Only if it fails, then we recommend surgical intervention, whether it's toe-pass ablation treatment for plantar fasciitis or whether it's Achilles tendon surgery, retrocalcaneal exostosis resection. We always try this first.